Good morning, everybody. My name is Shanice. I am here to review my proposal for the patient education handout that I have for you today. I do have an example to kind of go over. I'm going to go ahead and jump right in. I did choose a red folder, being that red is the color of head and neck cancer awareness, and that is specifically what our office and facility here handles. We do treatment plans, chemo, radiation, stuff like that for head and neck cancer patients. So the first page here, when you open it up, is basically just an introduction page. It's gonna kind of give you what to expect in the packet. The next page is the treatment plan. So this is their specific treatment plan. This they can fill out with their doctor or with their loved one. I would recommend having the doctor fill it out or filling it out together. It has a spot for surgery, chemo, and the radiation schedule. Also, any future follow-up appointments that would be scheduled out. Prescription information, so any of their medications, the dosage, that way it doesn't get misconstrued, forgotten, etc. Also, possible side effects. And then there are also spaces for over-the-counter medications that could be recommended. Things like burn creams, throat sprays, ibuprofen, all of that kind of stuff would be all listed on this page here to help them stay organized. The next page is the what to expect page. This page is going to review not just the typical side effect information that most people would experience with chemo and radiation, such as hair loss or fatigue, but this is going to be specific to head and neck cancer patients because they will experience burns in their throat. A lot of them will experience temporary to permanent loss of their saliva glands and their taste buds. So the way they used to eat is not going to be the case moving forward. This is going to be ways to combat that, ways to kind of manage not just the side effects, but also kind of adapting to their new lifestyle as far as their eating habits. So if they have a feeding tube, this goes over, how to keep their calorie count up when using a feeding tube. Also things to use in the throat. So if they are trying to eat through their mouth, then there are different kinds of throat sprays and stuff like that that they can get. So that is all information here specific to them, the tips and the tricks and all of that kind of stuff. The next page is going to be our resources page. Now our resources page, excuse me, is specific to our local area here. It's going to have contact information, our office, taxi cab services, all of that. It's also going to have our support group information for the hospital here, and then reading material and financial support information. Now financial support meaning our state offices and any kind of sponsorship programs, grants, things like that could be going on. Being able to apply for disability, Social Security, all of that can be done over the phone, so that's all included on here also. This is our sponsors page. Now our sponsors page is going to include businesses that we've worked with in the past and that are willing to work with us on this current project. They are either donating services or their time / funding for our packets specifically. They also, some of them provide discounts for our patients. Now the overall budget for our packets is about $1 a packet. We like to keep about 100 on hand. We should go through 100 in probably about a month to 2 months, depending, on our kind of patient flow. It really is going to set the standard for our office. Now, we care about our patients. We care about their health, their wellness, and not just their treatment, but their future. This packet is not only going to help them stay organized, it's going to help them with their education level. The Journal of Clinical Oncology says that in their study from 2004, that 45% of cancer patients do not understand their treatment plan and their diagnosis. So that is something that I hold very personal because I have experienced head and neck cancer within my family. This packet would have been something that would have been invaluable to us at that time. Not just staying organized, but also something for people coming in that may not be able to attend those appointments with their loved ones. they aren't at a loss. They aren't relying on information through the grapevine. They are getting it all firsthand here, and they're able to not only hold their loved ones accountable, but they're able to make sure that everything is going as planned, and that they're doing everything possible to take care of themselves. So it's extremely important. This is also going to be something that helps them focus on their treatment. They aren't having to search out this information on their own. It's already all here for them. And it just really increases the probability that they will get more help, more support groups, more financial assistance. And that stress will, eventually decrease for so many people. I really don't think at $1 per packet, this is something that we can pass up giving to our patients. And I really hope that everybody feels the same way. So if anybody has any suggestions on the packet or any questions, please reach out to me. But otherwise, thank you, and I hope to hear from you soon.